I think it's well, it's unprecedented here in Ohio, and it is very exciting. The other thing is, we can't just stop there. I mean, as you all know, and we're not going to go away and give it up. So let me just give you some of the. By the way, 40% of all these prescription opioids prescribed come from emergency departments nationally. 40%. So now reached agreement with a chunk of the prescribers to get this under control. From 93 to 2005, opioid prescribing for pain-related emergency room visits increased 23% to 37%. So people are beginning to realize, those out there that want to traffic or those that need to get treatment, they found a nice outlet for themselves. Just get into those emergency rooms, which we are now, of course, going to shut down. Between 1997 and 2010, opiates increased from 7 pills per person to 67 pills per person, 100% increase. That's how serious this is. You know, we were on this about a year and a half ago, right, working on this. Now there's stories. The biggest problem we have in America today is prescription drugs. And somebody thinks it's always down where they're poor. So, well, you know, there's a lot of it where people are poor. Guess what? It's next door to you, too. It's not just something that you find some other place. From 99 to 09, a 335% increase in Ohio's death rate due to unintentional drug poisoning. 2007, unintentional drug doses has been the leading cause of accidental deaths. In 2010, prescription painkillers accounted for nearly 45% of unintentional overdose deaths in Ohio. This is a bad number here. I mean, they're all bad. 27% of Ohio's high school students are using illegal prescription drugs. Now, we're going to have an anti-drug day in the schools. And we want to tell these kids 24/7. We're really going to have a whole month where we're going to be working on this. And it doesn't take a genius to tell kids not to use drugs or big fancy planning or anything else. You know, we're going to be on this and letting kids know that you're going to wreck your brains. And you've got certain skills and talents the Lord gave you. You've got to use them. And if you use these drugs, you're going to destroy that. But we got to tell them all the time. All the time. In the school. Mom and dad. Everybody. And that may not still be enough. So we're now embarking on another venture here that is really going to be significant. We know the state of Washington is engaged with the entire universe of medicine, pharmaceutical companies, all the people they could potentially prescribe. And we want to work to drive a protocol with all of them. Not just the emergency rooms, but all of them. You know, and one thing we don't want to do is deny people who have chronic pain, and anybody that has chronic pain, I don't think we can even begin to understand the problems that they have. I will tell you that there are breakthroughs, or there is research now to try to figure out how to deal with chronic pain problems. Up at Ohio State, the research on deep brain stimulation, the ability to use ultrasound, which is being experimented with up in the Cleveland area. We're going to find some other answers to this problem of chronic pain. We must. And the study of the brain, which they just opened up a big brain operation up here at Ohio Health. I mean, this kind of research is critical. We're getting to the bottom of all this. But in the meantime, we don't want to tell doctors how to practice medicine. But the increase in the prescribing of these pills is an explosion. And it's not acceptable. So we're going to work with the Dental Association, the Medical Association, all the associations that they think we have to work with to see if we can come up with a way to reach some protocol guidelines in the state of Ohio. Now, the state of Washington is they're the leader in this. They're the pioneer. We don't going to do with all that they want. We look at what they do, but we figure out what we can do in Ohio. And I believe that we can get the medical community to work with us. We're not out here to tell them how to do their jobs or how to practice medicine, but we are out here to say that this explosion has to be dealt with. So, you know, if a doctor needs to prescribe a large volume of these pills, I think maybe the doctor ought to have a second doctor's opinion. Maybe a governor on the first doctor to make sure that the practice that we are engaging in is the right one. I mean, how many of you would ever go and have an operation without consulting somebody for a second opinion? And I think in this world it makes a lot of sense. Now, we'd like you to get behind this, because there'll be some people that'll be reticent. They'll be worried we're getting into their knitting, and we don't want to do that. But we also can't look the other way, because it's our communities and our children that are at stake here. So please figure out how to engage with us to make sure that we can move some things forward and reach these protocols. Now, we have some other good news, and that is that, see, I'm a believer that in many cases, hopelessness is what gets people into the business of addiction. Can't get a job, bad marriage, all kinds of kids in trouble. What we're trying to do is to strengthen the economy in this state. Now, I can tell you that over a long period of time, Ohio was ranked about 48th in job creation. In the month of February, after a lot of work, after a lot of naysaying and a lot of opposition, in the month of February, Ohio became the #2 job creator in America, and we are now the #5 job creator in America over the period of the last year. Now, I believe that's a... Go ahead, ladies, you can clap. That's good news, okay? Now, the reason why I think that's so important is I was just down in southern Ohio the other day, down in Ironton and Portsmouth, and their unemployment levels now are about the statewide average. It's fantastic. Because I think as mom and dad are able to work, it makes the family stronger. And when mom and dad are happier and stronger, it helps the kids. We have too many children in our state who are in poverty. We have too many poor people across the board. But if we can bring the jobs in a consistent way, and there's ways you can get it done. Yeah, we have to manage our budgets. Yes, we have to streamline our regulations. We have to have better education, all those things. But when we do them and they produce results, then I think it's another very significant weapon in the arsenal of what we need to win this battle. Enough said on that subject. Let me just go back to how I started. We're partners with you because we're in a position to do some things. I don't ever want to have to wake up and say, you know, why didn't I do that when I had a chance to right some wrong or to give people some hope? You're right there at the grassroots. Work with us. Talk to us. Can't have everything all at once. Life doesn't work that way. But I think we are making a lot of great progress. And for all of you, what a gift to have the patience, the knowledge, the tenacity, the kindness, the forgiveness, and the generosity to deal with people who have these addictions. The Lord's smiling. Thank you for what you do. God bless you. See you next time.